Is the test for knee flexors, so we're going to be testing the hamstring group. So for the starting position, you're going to have your patient starting lying prone. For grade 3, which is just going to be maintaining the position, you would put the patient's knee into 90 degrees of flexion, palpating at the distal thigh, and then just ask them to maintain this position. So can you hold your foot here? That'd be a grade 3. To test it as a single unit, you would offer resistance straight down. So again, having them hold this position here, don't let me move your foot down, starting at 90 degrees, and then offering moderate resistance for a grade 4, maximal for a grade 5. For the medial group, you would put the leg into internal rotation, so the toes are going to be facing away from the therapist, and you're going to be offering resistance down and outwards, again palpating at the medial thigh. So forward would be for moderate would be 4, maximal would be 5. For the lateral aspect, you would put them into external rotation, so the toes are facing towards the therapist, and just palpating more on the lateral aspect. And that time you're going to be offering resistance more down and in. For grades 2, you would have the patient side lying with the testing limb on top. So we'll say that the testing limb is the left leg. You're going to be cradling right under the knee and then supporting at the ankle, and then just ask them again to flex their knee. Any range of motion would be a grade 2. And then for grades 1 and 0, you would have them lying prone again. Again, putting them in that in the 90 degrees of flexion, and then just asking them to try to pull their knee in. So any kind of palpable contraction would be a 1, and then no movement would be a 0. For knee extension, you're going to have your patient start short sitting. You can put a wedge or just offer support at the distal thigh that you're testing at, and then just ask them to complete the range of motion. So can you straighten your leg? Good. Once they can do that, that would be a grade 3. After that, you'd put them into extension and then just offer resistance at the distal leg. So moderate would be a 4, maximal would be a 5. For grades 2, you'd have them side lying with the testing limb on top. And then you just cradle under the knee and then offer support at the ankle and just ask them to straighten out their leg. So partial range would be a grade 2 for that one. For grades 1 and 0, you would have them lying supine, standing at the same side as the testing leg. Then you're going to palpate right above the knee at the tendons and just ask them to straighten their knee. So any kind of contraction would be a 1, no movement would be a 0. An alternate test for this would be to support underneath their knee and then ask them to straighten into the bottom hand. This is the goniometry test, our measurements for knee flexion. So you're going to start your patient in supine. You're going to put going through the range of motion first. So the normal range of motion would be 130 to 140 degrees. So you would just do knee flexion, looking for a soft end feel because of the muscle bulk. After that, you're going to place a towel under the ankle just to make sure that they're in full extension, and measuring that first. So the fulcrum is going to line up with the lateral epicondyle of the femur. The stationary arm is going to be in line with the midline of the femur, using the greater trochanter for reference. And then the moving arm is going to be in line with the lateral tibia, and using the malleolus or the lateral malleolus for reference. After that, you're going to move them into their range of motion. Just hold it there. So that would be about 132 degrees of flexion. extension, you're going to start your patient in supine as well. You're going to also start with a towel under the ankle, just so the knee is able to be in complete extension. For the passive range of motion for this one, you're just going to offer slight downward pressure at the knee, making sure, or feeling for a firm end feel, making sure that they're not going into hyperextension, but you should look for about 5 to 10 degrees for a normal range. For the goniometer, the fulcrum is going to be lined up with the lateral epicondyle of the femur. The stationary arm is going to be in line with the lateral midline of the femur, and using the greater trochanter for reference. And then the moving arm is going to be in line with the lateral tibia, using the lateral malleolus for reference. So again, they're just going to exert slight downward pressure, and then making sure everything's in line, looking for 5 to 10 degrees. This would be about 0.